I was going to a meeting of the Physicians Council. We saw somebody walking down the hall toward us. It's a long, straight hall. We heard a kerplunk in the hall, and we both got up and ran to the hall and found Dr. Bell down. He was getting weak. His speech was not clear. Started talking to him, trying to assess exactly what was going on.
He was taken to University Hospital. He was also found to be in an irregular heart rhythm called atrial fibrillation.
What happens in atrial fibrillation is, since the heart is not beating the way it should be, the upper chambers don't beat, blood can clot, and from there it can dislodge and can cause a stroke.
The first I heard that Howard had fallen ill, I was with my daughters. My children were very upset. I was upset, but I was telling him, it'll be okay, it'll be okay.
The thought of losing my dad, I think I always thought, because of his work ethic, his drive and stress, that he would have medical problems eventually, but nothing could have prepared me for this outcome.
You know, that thought for 10, 15, 20, 30 minutes as it passes by, not knowing what's really happening, was terrifying. What we knew is that he had went down. And then when they came and told us that he'd had a stroke and that he was completely blind, it was horrible. A man who has dedicated his life to making people see. It was devastating.
There was no question that we would be going to Mercy for heart surgery, and it would be Dr. Buckley. It was just, foregone conclusion. I knew that he was thinking more clearly when he, quietly asked, how's the office? Who's taking care of the patients?
Who's going to take care of them? Are they going to, get the care that I thought they needed to have and that they wanted? And in my entire life, there's been nothing more important to me than the patient care, because we're all patients at some point.
The thing that makes Dad unique is that he doesn't quit.
Having the shoe on the other foot, when you're in a situation with your own family, what I learned from that is how important it really is as a care provider that we really connect with our patients. That very real connection, I don't think ever really hit home for me until this happened to my dad.
Never has there ever been a question about the quality of the care that Anderson provides.
Gosh, I can remember when the hospital was just a thought in somebody's mind, and then we had the small hospital, and then we had a bigger hospital. Watching it grow and watching it become what it has made me realize that all those things over the years that all the physicians and all the hospital staff have done to try to make this place what it is paid off.
It's several years in a row, 11 years in a row, as a matter of fact, have been named in the top 100 hospitals. And this is a very, not a very small community hospital, but it is a community hospital. And that's an achievement we're extremely proud of here.
Mercy Anderson has been in this community for a long time. And this tower expansion, it gives us all private rooms for our patients. It gives families the ability to stay with patients, and it allows for us to care for the patient and the family in a patient, family-centered care environment. It's critical.
I always think of a patient as my own family, and I strongly believe that we should have some privacy. They should feel secure in the room.
The tower is one way, and a significant way, for us to be able to deliver the quality care and the high-intensity care that we need for these patients.
I love the fact that they're building a tower, because I want my children, my grandchildren, to have somewhere to go. And I believe that my grandchildren will stay here.
We have the opportunity now to make this an even better place than it already has become by giving of ourselves and financially to the hospital. It has grown in the time that I've been here to a point that we all love. It's not fun to go to the hospital, but it's good to go to a hospital that can provide the service and facilities that it does, close to home, close to your family and friends, and it makes it one of the best things that we can do to provide support to this kind of facility for now, for our children, and our grandchildren.